Hello and welcome back to A Doctor's Diary, practical medicine for everyday life. Today we are discussing Chlamydophila infections, an important group of intracellular bacterial infections that primarily affect the respiratory system. The most relevant human pathogens include Chlamydophila psittaci, Chlamydophila pneumonia, and Simkania negevensis. These bacteria belong to the Chlamydiaceae family and are obligate intracellular organisms, meaning they require host cells to survive and replicate. A characteristic feature of all chlamydial organisms is their complex life cycle, which includes two forms: the infectious extracellular elementary body and the intracellular metabolically active reticulate body. This intracellular lifestyle allows the bacteria to evade certain immune mechanisms and persist within host cells. Chlamydophila psittaci primarily infects birds and causes ornithosis, also known as psittacosis, in humans. This infection occurs worldwide, but is reported relatively rarely. Birds serve as the main reservoir, including poultry such as turkeys and ducks, as well as domestic birds like parrots and pigeons. The bacteria are found in respiratory secretions, feces, and feathers of infected birds, and can remain infectious for several weeks, even after drying. Transmission to humans usually occurs through inhalation of contaminated aerosols or dust from infected birds, although direct contact with birds may also result in infection. Human-to-human transmission has not been confirmed. The incubation period typically ranges from 1 to 4 weeks. The disease usually begins abruptly with flu-like symptoms such as chills, high fever, headache, and muscle pain. Many patients develop a persistent dry cough due to interstitial pneumonia, sometimes accompanied by pleural chest pain. Imaging studies often reveal unilateral or bilateral infiltrates, and splenomegaly may be present in a significant number of cases. Laboratory findings frequently show leukopenia and elevated inflammatory markers. The disease may last several weeks, and severe complications such as myocarditis, endocarditis, thrombophlebitis, and central nervous system involvement have been described. Diagnosis of Chlamydophila psittaci infection can be difficult. Culture remains the gold standard, but is rarely performed because it requires specialized laboratories and carries biosafety risks. Polymerase chain reaction, or PCR, is currently the most reliable method for detecting the pathogen in respiratory samples. Serological testing is often used in routine practice, with microimmunofluorescence considered the reference method for species-specific antibody detection. Treatment typically involves tetracyclines, especially doxycycline, administered for 10 to 21 days. Alternative therapies include macrolides such as erythromycin or azithromycin, as well as newer fluoroquinolones. Preventive measures focus mainly on controlling infection in bird populations and reducing exposure to contaminated dust. In environments where infected birds are present, protective clothing and respiratory masks should be used, and proper hygiene measures are essential to reduce transmission risk. Chlamydophila pneumonia is a very common cause of respiratory infections worldwide, and most individuals are exposed to this organism at least once during their lifetime. The human respiratory tract serves as the main reservoir, and transmission occurs through respiratory droplets and saliva contact. The incubation period is estimated to be 1 to 4 weeks. Clinical manifestations range from mild upper respiratory tract infections, such as pharyngitis, sinusitis, and bronchitis, to community-acquired pneumonia. Many infections remain asymptomatic, but symptomatic cases may present with persistent cough, mild fever, and prolonged respiratory symptoms. Rare complications may include myocarditis, endocarditis, meningoradiculitis, reactive arthritis, and erythema nodosum. Diagnosis relies mainly on PCR testing of respiratory samples such as sputum, bronchoalveolar lavage fluid, or throat swabs. Culture methods are technically difficult and rarely used. Serological testing with ELISA is widely available but may show cross-reactivity with other chlamydial species. High antibody titers combined with compatible clinical symptoms provide the most meaningful diagnostic information. Treatment is similar to other chlamydial infections, with doxycycline considered first-line therapy for 10 to 21 days, while macrolides such as azithromycin or erythromycin, as well as fluoroquinolones, may be used as alternatives. Simkania negevensis is a less well-known pathogen associated with respiratory infections, particularly in children. It has been identified in cases of bronchiolitis, asthma exacerbations, and community-acquired pneumonia. The distribution of this organism has been documented in several countries, although epidemiological data remain limited. The main reservoir is believed to be humans, although the organism has also been detected in free-living amoebae. Transmission occurs through respiratory aerosols. The incubation period and duration of infectiousness are not clearly defined. Clinical manifestations resemble other respiratory infections and may include bronchitis, bronchiolitis, or pneumonia. Diagnosis is primarily based on PCR detection of bacterial DNA, as culture methods are technically demanding and rarely performed. Serological testing may detect antibodies using immunofluorescence techniques, although standardized commercial tests remain limited. Treatment follows the same principles as other chlamydial infections, with doxycycline remaining the treatment of choice for 10 to 21 days, while macrolides and fluoroquinolones may be used as alternatives. Chlamydophila infections remain an important cause of respiratory disease worldwide. Recognizing exposure risks, understanding the clinical presentation, and initiating timely antibiotic therapy are essential steps in preventing complications and improving patient outcomes. Thank you for watching A Doctor's Diary, practical medicine for everyday life. Stay with us for more short clinical guides designed to simplify everyday medical practice.